Hi, Ters. It's Evan Food Tasting right now. So, I want to talk about something interesting right now. So, about my gluten-free diet. So, I have been on a gluten-free diet now for just over 2 weeks. I want to give tips for people who are considering starting a gluten-free diet. Now, gluten-free diet is used to treat many conditions like celiac disease, which is an inflammation of the small intestine, autoimmune disease, also gluten intolerance, gluten allergy, gluten sensitivity, or just people looking for a different diet. So I want to talk about basically how I do the gluten-free diet personally and how I've made mistakes in the past and how I can do it better. So, and how you can do it better. I'm not a doctor, I'm not giving medical advice. Not a big ass doctor, a big ass cigar. So, basically, long story short, I found back in 2012 when I did the diet, I was too eager, or I was too like, okay, I really want to get good results too quickly. I only tried the diet for 3 weeks. That's not long enough. So now in current 2016, 2017, I want to explain how I'm doing the diet in a better way, because back then in 2012, and you may have seen this back in my very old videos back in 2012, how I was trying the gluten-free diet. I wasn't really giving it a fair shake. Really, I was not giving it a fair shake. I was really, too eager too quickly. I was like, come on. I was hoping to see results within 2 or 3 weeks, and really you have to give it a couple months. So the first tip I can give you is give a gluten-free diet if you're celiac, if you are have any kind of medical issues from gluten. Give it a solid I would say a solid 2 to 3 or 4 months. Obviously, I'm not a doctor. I'm not giving medical advice. This is what I know from experience. So, not medical advice. Don't sue me. So first off, give it time. Give it a solid 3 or 4 months, 5 months, 6 months before you make any decisions, because it takes time, from what I understand, for the gluten to leave your small intestinal tract. So I think it takes at least 6 to 8 weeks for the gluten to entirely leave your small intestinal tract. I think for the damage to actually heal, if you're celiac, it can take, I think, around 6 to 18 months for the damage to heal fully. So, and for some people who are adults, especially people who are older, people in their 40s and 50s who have had celiac disease for a long time, it could take 5-10 years for the damage to heal. So that's the first tip I can give you, is don't rush it. Don't say like, okay, I've been on the gluten-free diet now for 3 or 4 weeks, I'm just going to quit. So that's a mistake I made back in 2012. Another thing is, it's very important about the gluten-free diet, is be careful when trying foods, because some foods have what's called hidden gluten, hidden, air quote. And again, this is not medical advice, but I was looking on Google. I've been using Google as a research on my computer and also my iPad. I've been finding out that certain foods like jelly, grape juice, grapes in general tend to have gluten. Even bananas have a potential reaction to celiac disease, even though they don't have gluten themselves due to their fresh fruit. I found that many different types of food have potential gluten, like chocolate even though it's made from milk, can have potential gluten because it has barley malt, which is like a sweetener. Tea even, like tea you drink, can have gluten potentially because of barley, which is wheat protein, because wheat, barley, and rye you avoid, so be careful. Another thing is, definitely, if you're going to commit to a gluten-free diet, definitely commit to it voluntarily. Unless you are definitely allergic, or somebody that has like a peanut allergy, who's going to like burst out in hives and stop breathing and go into anaphylactic shock, I'd say only do it if you really are required to. So if somebody who's a little bit sensitive to gluten, not medical advice for the last time, somebody who's a little bit sensitive to gluten and just has a little bit like cramping, a little bit of diarrhea, then really think about it, because it's a very hard diet to follow and it's very rigorous. So, and definitely give it a fair shake. So if you're going to commit to it, like for myself, I have celiac disease and I was diagnosed back in 2011, and my doctor's really been pushing it. Nice big ass doctor, big ass cigar. So, and he's really been pushing it because there's a long-term risk of intestinal cancer, and he really has been pushing the diet for a long time, even though I'm asymptomatic for the most part. The only symptoms I might possibly have is mood symptoms. So keep that in mind, is unless you're really required to, like someone who has celiac disease is really required to follow the diet, because it can cause irreversible damage to their small intestine. Also could potentially increase the risk of lymphoma, small bowel cancer, also infertility, osteoporosis. So somebody who has celiac disease is obviously required to follow the diet, or they really should. Same thing as smoking. You really should quit, but you don't. So you get the point. So I'm really supposed to follow the diet technically, and I didn't follow for many years because I don't have any intestinal symptoms. But unless you're really required to follow the diet, I wouldn't recommend it. If you're just somebody who's trying to lose weight, or somebody who doesn't have celiac, or just somebody who's not allergic to gluten, then a gluten-free diet may be a very healthy diet in many ways, but it's not going to be the best thing for you. It's a very strict diet, very tough diet. So I would only do it if you're really, 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 really positive that you really want to lose, or you really are required to follow it. In other words, if you're somebody who's just trying to lose weight, or just somebody who's trying to look cool, gym fetish, whatever, big ass cigar for life, don't do it, because it's really designed, a gluten-free diet is designed for somebody who can't tolerate gluten, or can't digest gluten. Another thing is, when you are on a gluten-free diet, there's a lot of things you can eat. I found out a lot of things I enjoy, like eggs, things like peanuts, things like wraps, and gluten-free English muffins are actually really good. So some of the food, another reason you don't want to follow it, if you're not required to, you don't have to, is a lot of the foods are kind of crappy, honestly. Like the gluten-free bread is very expensive, $6, $7, $8 a loaf around here, even at Stop and Shop, which is cheaper than Rochebur's in Massachusetts, and tastes like freaking cardboard. So I was going to use the other word. But it tastes like freaking cardboard. It's really like, you do not want to eat gluten-free bread and spend that much money to basically eat something that tastes like freaking cardboard unless you're required to. So, and I keep emphasizing that, even though I'm repeating myself, is only do the diet if you're absolutely required to. If you're somebody who's just trying to lose weight, don't do it. So, anyway, give me your thoughts. I've been on the diet for over 2 weeks now. It could take a couple of years for the damage to heal. So, give me your thoughts. Big ass cigar for life, big ass gluten for life. Bye.